Okay, Chapter 8, Lifespan Development. Think about your life. Think about how your perspective changed as you grew. Different things happened at different times in your life. This is what lifespan development is going to be all about on Chapter 8. So open your books, page 175, and start reading and reviewing and follow along on the slides. The different age spans are categorized into different times of people's lives. Infancy is from birth to 1 year. The toddler phase is 1 year to 36 months, just when they're toddling about. Preschoolers are 3 to 5 years, and then a school-age child is anywhere from 6 to 12 years. They reach adolescence when they turn 13 and on through 18. After that, there's early adulthood, and then middle adulthood, and then late adulthood. So let's talk about infancy from birth to 1 year and the types of things that you can expect from an infant. So a newborn is actually, if you look at the terminology, a neonate is the first month of life. So 1 month old, at the end of 1 month, they actually are considered an infant. Prior to that, they're neonate, but they still fall into the infancy category. There's some physiological differences. Obviously, they're smaller. They're anywhere from 6 to 7 pounds at birth on an average. You can expect the weight to double by 6 months old and triple by 12 months old. So you would expect a 1-year-old to be approximately 20 pounds, okay, which is about 10 kilograms. Infants' heads are about 25% of their total body weight. Their heads are much larger when you take into proportion their size. They've got a smaller body and a bigger head. Their airways are a lot more narrow. They're about the size of a straw or smaller. That means they can easily become obstructed. The nose and diaphragm are used a lot for breathing. So you can see their ventilations, they're breathing a little bit more. Physiologically, they have antibodies that are passed from the mother to the child in pregnancy. Which is a good thing. I mean, it helps them to fight infections. And also, if they're breastfed, they have additional antibodies that are passed from the mother to the child. They have more reflex. They startle easier. And you can see this when they throw their arms out and they spread their fingers. They grab with their fingers and arms. They have a palmar reflex. Remember, the palm is with your hand. So they grasp objects when you put something into their palm. There's also the rooting reflex. So if you've ever seen or held a little baby and they start rooting around looking for something to eat, they turn towards the side that the head is touched. So if you touch their cheek, they'll turn towards that. And then they'll start trying to suck. They have a sucking reflex, so when you stroke their lips, they'll suck a little bit or try to suck. Their sleep patterns. Their sleep is pretty irregular. They sleep quite a bit in the beginning. They begin to regulate after 2 to 4 months of that, though. Then they start sleeping through the night. For the most part, they'll probably still have to be up usually about once a night to be fed. The extremities grow from a combination of growth plates and epiphyseal plates in the bones. So these, if they get broken and when they're really young can have problems. They can have growth problems or unequal growth. The physiological more difficult differences, their fontanelles. So their little sutures in their brain are not fused at birth. And the posterior fontanelle closes in 2 to 3 months. Anterior fontanelle closes between 9 and 8 months. So they have a soft spot there, which can damage the brain easily if injured. The other thing about fontanelles, if you see that their looks kind of their fontanelle looks kind of sunken, that could indicate that they're dehydrated. If it's bulging out, that means they have an increase in pressure in the skull. So a little bit more room. After our skulls fuse together, though, you won't see that as an indication of uh, dehydration or intracranial pressure. If you turn to page 177, you can get some developmental changes throughout the first year of some uh, more exact type indications of what to expect from the month-to-month range. Some psychosocial behavior. When kids, as they start to grow, they will bond. Bonding is a sense that their needs will be met. So when they're hungry, they're going to be fed. When they need to be held, they will be, and they start to bond with that caregiver also. There's also trust versus mistrust. If they have an orderly, predictable environment, then they'll be peaceful and more calm. If their environment is disorderly and irregular, they might develop some anxieties and insecurities. Scaffolding. Scaffolding is learning to build on what they already know. As they get grow bigger and bigger, they're going to build on little small successes. And then the temperament, and that's the reaction to the environment. The toddler phase, 12 to 36 months. Toddlers are starting to toddle around and get into things and develop a little bit more independence. Some physiological differences. Pulmonary system. Their alveoli are increasing in number. So also their bronchial airways are branching and growing. So their body's becoming more efficient. Their nervous system. The brain is about 90% of an adult brain weight, and they're starting to develop fine motor skills. So you'll see them start being able to do things with their fingers more. Their musculoskeletal system, the muscle mass and the bone density increases and they become stronger. Immunity. As they're getting older, they don't quite have those antibodies anymore as their mother was feeding to them. So they're more susceptible to illness. They'll develop their own immunity pathogens as they become exposed to things. So this is a good time when they start getting immunizations. By 36 months, all their primary teeth should be in. Psychosocial behavior. They're going to begin to understand cause and effects. So that, if they drop something, that it might break, or this also is where they might learn the word no. And as we try to teach them, they might develop some separation anxiety, and they're going to start believing in things and develop magic thinking, imagine things, and they're going to start play acting things as they see how they are. And of course, we always encourage that with stories about Santa Claus and the Easter Bunny and magical fairies and stuff that they see on cartoons. So the toddler, um, 12 to 36 months, becoming a little bit more independent. Preschoolers are 3 to 5 years old. Preschoolers, even more independent now. They're getting about and they're starting to move around, and their physiological body systems continue to develop and grow, and they're getting more interactive and social skills, and they've starting to talk more and visit with friends and learn more. School age is 6 to 12 years old. Uh, this is a transition as they start going to school. They'll be spending less time with their parents and more time with their friends, and they are starting to understand right from wrong. They've started to see people that have been injured, and so now they fear being injured, and sometimes they think an injury might be a punishment for something they did wrong. So they'll be apologetic or I'm sorry. They'll also have their loss of their primary teeth, uh, less general supervision. They're going to have some developed decision making skills. They're more aware of self esteem, and they start to value opinion of their peers, whether they're positive opinions or negative opinions. Adolescence is 13 to 18. So, an adolescent is extremely independent. They're starting to work towards being out on their own. Um, so they'll usually go through some growth spurts, and uh, they'll get into that final stage of growth and start entering into puberty, and so they'll see physiological changes on their body. So, physiologically rapid 2 to 3 year growth spurts, they'll become sexually, start to develop sexual maturity. They're going to want to be independent. They have a great deal of concern for body image and peer pressure, and they don't want to be deformed or disfigured in any way. They might be prone to self-destructive behaviors. And they're starting to develop also their personal code of ethics. A lot of times they go into risk taking. They might not want to tell you what actually happened because they might have been taking a risk that might not have been appropriate. Must they're encouraged by their peers to do things and sometimes do some pretty stupid things. You need to encourage them to explain the circumstances surrounding any injury incident that they have. Early adulthood is 19 to 40 years. So, in the early adulthood, graduated from being a teenager and moving on, and now they're moving into job stresses in life, trying to establish an identity. They're developing love and romantic affections, and some of them might be going through a childbirth process now and developing new families. Accidents here are the leading cause of death. Lifelong habits are forming here. They should be in their peak physical condition, although our society has become more sedentary, and so there's a lot more unhealthy people out there. Psychosocial, job and family stress, marriage, childbirth, child rearing, accidents, happen and cause death quite frequently. Middle adulthood is 41 to 61 years. And this is kind of a time when they're starting to wind down, um, being more reflective, but some of them may be going through the midlife crisis. Start having vision problems, start wondering, if they did the right thing throughout their lives, maybe want to change things, might have menopause starting for women. So, vision difficulties, cancer, heart disease starting to develop. It's going to be difficult to control their weight. Some of them are experiencing empty nest syndrome. Start caring for elderly parents. There might be feeling a scrunch, pressures from both ends, taking care of the elderly and maybe even still taking care of some of their young. Late adulthood, 61 years and older. So older adults are, some of them tend to be pretty active still. Others might have succumbed to various diseases and have some difficulties as their body, their respiratory system, and cardiovascular system are getting old and starting to deteriorate sometimes. So, body systems are becoming less efficient. Their living environment might be some changes. They're going to be deciding how much longer they can live at home or if they need assistance. Their self-worth. Um, Depression is common here. They'll have some financial burdens as their income might be dropping. And there's concerns about death and dying. They're seeing other friends and relatives die, and they know that, time is limited in our lives. So, in review, some considerations you might uh, watch for. Understanding the basic physiological and psychosocial development for each age group will assist you in communicating with and assessing patients of various ages. They'll have a different perspective depending on how old they are and what stage of life they're in. Physiological differences between the ages are going to affect your care. Examples include differences in the respiratory systems from a younger patient to an older patient. Any pre-existing medical conditions that might have taken effect. Infants and young children have less developed and smaller respiratory structures. So they have primarily respiratory conditions that might cause problems. Older people are more likely to have cardiovascular problems and heart problems. Your ability to communicate with younger patients will depend on their stage of development. This can range from fear of strangers to separation anxiety from parents and embarrassment during adolescence. Older patients may have issues with denial or depression over medical conditions. Remember, infants present massive bursts of anatomical and psychosocial development in the first year. Although preschoolers begin to develop independence and reason, in many ways they still resemble the psychosocial development of toddlers. School-age children often are independent and logical, but that may crumble when they get sick or hurt. And then they want mom and dad. Adolescents are reaching physiological maturity, but they often face difficult psychosocial changes and peer pressure. Early, middle, and late adults vary greatly in terms of physiological development and conditioning. They also have psychosocial challenges unique to adulthood, from pressures and stress. So how are you going to approach a patient most effectively based on developmental characteristics? You're going to approach the infant a little bit different than you're going to approach the adult. Infants are scared of you. They have a fear of strangers. They've bonded with their parents. So Whereas an adult might still, be a little bit anxious about the scene, but might not necessarily be afraid of you. So, think about, does the age of your patient pose any assessment or care challenges based on the physiological development? Are they afraid of you? Are they worried about disfigurement? Are they worried about being hurt or getting in trouble? Uh, are they just worried that they might not come back and they'll be put in a nursing home? Depends on the age. There's different challenges they face. So you're called for an abdominal pain in a 16-year-old girl. She is with friends at the park. She seems hesitant to answer any of your questions. What characteristic of adolescent development is most likely the cause of this? She's a teenager. Okay? She's might be embarrassed. She might be worried that other people will find out that she did something. So what are you going to do to overcome that? Your approach to this is going to be geared towards, you know, getting her trust and getting her to open up and share with you what actually really happened. So you might have to take her off to the side or get her in the ambulance where she might feel a little more freedom to talk to you.